Hi everyone, welcome back to our YouTube channel. So in the previous video, we discussed very detail about the RRB exam, that is one of the central government exam. And also we discussed 15 very important questions from the RRB 2025. And today in this video, we are going to discuss 25 very important questions from the RRB 2025. Right? I hope you are preparing well for a competitive exam and also studying for academic year, right? Don't neglect your studies, keep on studying and keep on hard working for a good success, right? Why? Because the competition among the nursing student is very increases. Why? Because if the 100 students are passing from the PUC science, the 40 are admission taking to BSc nursing. The day by day the population of the student nursing student is increases. That's why the competition among the government job is also increases. That's why I urge you to study as much as possible when you are in a student life. That is the best way to get a success, right? And in this video we are going to discuss 25 very important questions from the RRB 2025, right? And also while you are studying, make your own plan or make your own strategy. Divide your subjects into hours. If you are studying a 6 hours, divide the subjects into hourly, 2 hourly, 25 minutes. Have you heard name of the Promodermo study method? So if you are studying continuously, you will tired. So use a Pomodoro technique. Study effectively 25 minutes and a 5 minutes break. Next 25 minutes studying effectively and a 5 minutes break. So this cycle is called as a Pomodoro cycle and always use in your study time. That's very useful. And before going to the study, make a 2 minutes meditations. That's boost your memory, right? I hope you are preparing well and all the best for your preparation. And let's see the some of the previous year question paper of the RRB 2025. Let's get started. Let us start some of the MCQs from 16 to 35. The 16th question is, that is, what was the term etiology refers to? Of course, we know that we discussed lots of talking in medical, surgical nursing or adult health nursing subject. Etiology, it refers to, that is always studying of the causes, the study of causes of the disease, particular disease, that is called as etiology. So here the option is D1, cause of origin of a disease, that is called as etiology. Next, 17th question, where are the testes located in the male body? Of course, this is the very easiest questions coming from the anatomy, that is the within the scrotum, that is outside the abdominal cavity is the right answer. Next, 18th question, the process of the uterus returning to its pre-pregnancy size and position after the childbirth. The options are retroversion, second one contraction, third one involution, and fourth one, that is afferment. So here the correct option is involution. So retroversion means the uterus tilting the backward, right? That is called as retroversion. The contraction means tightening of the uterus. The involution means it is a returning to its size and position after the birth, that is called as involution. This is the correct answer. And afferment means here the lower part of the uterus is called as a cervix, that is getting thinning. The thinning of lower part of the uterus, that is cervix, is called as a afferment. 19th question, the how many calories are provided by a 1 gram of carbohydrates? This is a very easiest question coming from the nutrition. The options are 4 calories, 7 calories, 9 calories, and 2 calories. So what is the 1 gram of carbohydrate that gives a 4 calories? Correct option, that is A. Next, 20th question, which layer of the blood vessels is the most commonly affected in the atherosclerosis? So generally, what is atherosclerosis? Atherosclerosis is one of the pathological condition. There is a accumulation of fat or a cholesterol or some other substance on a arterial wall. So generally, the three layers consist of a blood vessels. That is inner layer, outer layer, and a middle layer. Outer layer is called as a tunica externa, middle layer is called as a tunica media, and innermost layer is called as a tunica intima. So here the affected layer of the blood vessel, that is tunica intima, that is innermost layer of the blood vessels within the atherosclerosis. Next, 21 question, which organ is primarily responsible for the exchange of nutrients, waste products, gases between the fetus and the mother? Here fetus means baby, and there is only one connection, that is umbilical cord. Umbilical cord is making only one connection between the baby and a mother during a pregnancy. So here the correct answer is umbilical cord. It's a very simple question from the gynecology. 22nd question, which of the following are the common symptoms of the shock in the patient? Of course, the shock is characterized by tachycardia, hypotension, and a cold and a clammy skin. Here the answer is, that is all of the above. The above signs and symptoms are present within the shock patient, right? That's why the correct answer is, that is all of the above. Next, 23rd question, what is the full form of MTP? We already discussed it in the YouTube short, that is M refers to medical, T refers to termination of pregnancy. So MTP means it is one of the procedures to end up a pregnancy, right? It is also includes the rules and regulations with the regarding abortions, that is called as medical termination of pregnancy. It is one of the important topic in a gynecology. Next, 24th question, where is the appropriate site for administering the hepatitis B vaccine to newborn? Options are dorsal gluteal muscle, vastus lataris muscle, and deltoid muscles, and a subcutaneous tissue of the thigh. The best answer, of course, everyone knows, that is vastus lateralis muscle. Correct answer B1. Next, when we will administer hepatitis B vaccine? So generally it is given in the three shots. First shot, that is after the birth within the 24 hours. Second one, that is 1 to 2 months of the baby, and third shot, that is 16 to 18 months of the baby. Next, 25th question, what is the primary purpose of pre-implantation genetic testing before embryo implantation in vitro fertilization? So it is one of the very important diagnostic test in a genetic. So one of the question coming from the genetic, the pre-implantation genetic testing is only done for to identify the abnormalities of the embryo, or else identifying the diseases. So here the correct answer is to test for a genetic disease and abnormalities, right? Next, 26th question, where is the lower fold point of labia minora located in the female genital anatomy? The first option, that is clitoral hood. Second option, junction of the labia majora. Both are options are the wrong one. And the vestibule of the vagina and forming a frenulum, that is also wrong one. The correct answer is, that is C1, at the posterior commissure of the vulva, right? Next question, that is which of the following immunoglobulins is crosses placenta? So generally we already discussed it in the microbiology, that is immunoglobulin G. So what are the immunoglobulins? Immunoglobulins are the proteins present in our immunity system. These are fighting against the microorganisms. Those are called as immunoglobulin, also known as antibodies. So it's very important, and also study the remaining uh, antibodies functions and advantages and the disadvantages. Why? Because this is very important topic in the competitive exam. Next question, that is 28th one. Which type of angina is not relieved by a nitroglycerin is known as? So generally what is angina? Angina means chest pain due to decreased blood supply to the heart. That is called as angina. And generally the types of anginas are, there are four: stable angina, unstable angina, and nocturnal angina, and presmental angina. So here the unstable angina is not responsible to the, not responding to the nitroglycerin. That's why, so here answer is unstable angina. Unstable angina is not relieved by the nitroglycerin. Next, 29th question. Which of the following cells provide a humoral immunity? So what is humoral immunity? Here the immunity which is mediated by antibodies. The antibody mediated immunity is known as humoral immunity. So here the which of the following cells provides a humoral immunity? So generally that is B lymphocytes. The B lymphocytes are only responsible for the producing the antibodies at the time of infection. That is a main response from the immunity. Next, 30th question. The neural tube defect prevented by a which vitamin? Then first of all, what is the neural tube defect? It is a one of the genetic disorder, and mainly it is a improper or a defect in the brain or a spine or a spinal cord in a 1 month after the delivery, right? And mainly neural tube defect is prevented by the only vitamin, that is vitamin B9, that is also known as folic acid.